Australians living with rare metabolic diseases have been told they will no longer receive government funding towards expensive medical foods. Without access to proper diets, sufferers could go on to develop brain damage. Madeline Slattery explains.
For the past 5 years, Sophia Moore's meals have looked like this, each one delicately weighed.
One banana is 2 grams of protein.
She has a rare metabolic condition, which means if she eats more than 4 grams of protein a day, she could develop brain damage.
If she doesn't get the right diet, over time, it's irreversible.
1 in 25,000 Australians is born with her condition called Phenylketonuria or PKU. Families have been relying on money from the federal government to help pay for specialised low-protein foods.
They're really, really expensive. You can't buy them in the supermarket.
A loaf of bread costs $10, for 500 grams of pasta also $10, and a box of breakfast cereal costs just short of $15. Currently, sufferers of 21 conditions qualify for the food grant. Nationally, 950 receive the payment of $256 a month. It's been running since 2001, but overnight families were told as of December it will be no more.
They're left in a position where they actually cannot feed their children safely to avoid brain damage.
They're hungry, and unfortunately we can't just go to a supermarket or a bakery.
The Health Department says that foods for people managing protein metabolic disorders are now more readily available and cheaper than when the program began.
There are 3 suppliers in the country that provide these foods. That is it. They are mail-ordered, and the prices certainly are not cheap.
This is a small-minded government that is really hitting the hip pockets of families, and it's a pathetic decision.
What's come as the biggest shock to families and the National Support Group is that they weren't given any consultation in the lead-up to this announcement.
Yeah, it's heartbreaking.
Madeline Slattery, 9 News.